We have an inpatient department which counts 8 beds for males and around 17 beds for female and children.
The major responsibilities here first is to management of patients.
And Cosv is provided food for the patient also, morning and evening. Here in our location, there are some malnutrition due to the shortage of food. The more they are not eating enough, the more they become sick. Evening at 7, we put all the patient under mosquito net because of mosquito. Give anti-malaria and the temperature is still high. On that, we add chloramphenicol. This child is suffering of cellulitis.
We have an outpatient department, which is the health program for people for more than 5 years old, and the mother and child health, which is a program for monitoring the growth and the good health of the children under 5 and their mothers after the delivery. Yeah.
We are going daily to weigh all the child to know when the child is malnourished or is going heavy. 25 per day. We reduce all the number or the cases of polio and tuberculosis. We give this thing to the child who was fully immunized.
We are running an extended program of immunizations on daily basis here in the primary health center, and the same is happening in the other 2 locations. And twice per year we organize, with the collaboration of UNICEF and WHO, a mass polio campaign and the mass measles campaign, because again measles is the main cause of death among children under 5. This is Cosv main pharmacy for Nyal. We receive every 3 months a plane cargo with drug supply for the primary health care center and for the 9 PHCU that are referred to this location. Once the drugs are coming, we register them into the stock cards, and then we distribute to the primary health care center in Nyal, or with our pharmacy assistant, we send them to the primary health care unit.
The sign is, if they have diarrhea, coughing, all the medicines are here. If they come here, I give all the medicine to them.
We are part of a eWarn system, which stands for Early Warning Alert and Response Network. It was installed by WHO to monitor the outbreak disease like malaria, meningitis, cholera, which are expected every year at the beginning and at the end of the rainy season.
We have a lot of cases of malaria. Malaria here is #1 killer disease.
Common disease here is malaria and water diarrhea, plus upper respiratory infection, plus STD.
We also have cases of worm infestation, which are very common. The other second important common disease which we have here is pneumonias.
100 patients or 150 patients per day.
Syphilis is a very common disease here.
We are running an extended program of training for our community health workers.
Capacity building of our local staff here, because we have various staff here. We have community health workers, we have maternal child health workers, we have traditional birth attendants, we have pharmacy assistants, and we have also other supportive staff.
If we learn more, we will do more better.
My main work has been to supervise the qualified laboratory staff in these locations, and also to train auxiliary lab assistants.
They don't use pit latrine, so they help themselves in the bush. And when they help themselves in the bush, when the rain comes, all these feces are drained into the water points, and they fetch this water and they use the water for domestic use. In fact, we admitted over 45 people with cholera. The Italian embassy 2 years back, they gave us funds, and we put up a water system with a very big tank, and this water tank is supplying the health facility, both the wards and the outpatients, and the maternity and the lab, Also in collaboration with UNICEF, they did put for us borehole, water pump borehole, which is also working and is also serving the facility and is also serving the community. Safe, they are clean and safe. They have been tested and they have been found to be good water for human consumption.
This is the food for the patients admitted in the hospital, and some food that used to incentive the treatment of tuberculosis.
Because we don't have road to bring the food, and this side full of water with animals. Our area is a log land. At least you go with the helicopter or you go with the airplane, there's no alternative. You see this kind of coconut, you cut and you dig inside. You used to be a local canoa. You go, maybe you go with 10 days, and 10 days come back here to the nearest village to bring the food for your children.
There is also some food for the staff and some vegetable oil enriched with vitamin A to prevent avoidable blindness in the children. We have this big library that is equipped with textbooks especially related to health, where the community health workers can come in the afternoon study diagnosis and treatment of various diseases. Last years we also installed this television with VCR that is equipped with a cassette given by UNICEF or WHO in local language for the course of the community health workers, which treats the prevention of diseases like HIV, AIDS, malaria, cholera, or are improving nutrition and breastfeeding for the pregnant women. Due to the isolation of the area for safety reasons, we have satellite phones and 2 radio contacts daily with the Nairobi headquarters and with the other location around South Sudan. Because there is no electricity here in South Sudan, every source of power for the hospital or the compound is by the sun with the solar system.
The strength of this program is that Cosv works very closely with the local leaders.
Cosv are the people that taken care of life of human beings. They came here during the war, and there is a lot of war. They face a lot of problems together with us. Or if there is any fighting, we evacuate together. And we are still requesting the agencies to continue with the development in our areas, giving support to our community. The life now is all right because we have got peace and we have become an independent government. Milano government should continue giving support to Cosv organizations because we don't want Cosv to live here. Cosv is the mother of this community.
This hospital needs an expansion. It needs a theater, it needs at least maybe 1 pediatric ward, and this is something I'll request if the donors can look into it and support this facility.
Imagine tukiishi kwa wenyeji, tuna have kuweka ta have kututafuta kwa ma mixtape. Imagine so searching.